Yes, ma'am.
So mineral metabolism is actually very important only. We have many essays coming from this chapter. So what are minerals
Mm.
basically? Minerals are nothing but trace elements which we require in milligrams in our diet. And they are so important that if we don't take these minerals in the diet, we usually suffer with deficiency disorders. Suppose if we don't take iron properly in the diet, we suffer with iron deficiency anemia. Suppose if we don't take proper iodine in the diet, we suffer with goiter, thyroid related disorders. So minerals are nothing but, these are also micronutrients, they are called as. Micronutrients are like vitamins and minerals fall under the category of micronutrients, so which are essential only in milligrams, but without which we usually suffer with disease. Okay, so among this also there are certain minerals which we require in milligrams, and there are certain other minerals which are called as trace elements which we require in a very small proportion. Okay, beta. So these are called
Mm.
as trace elements. Okay, like essential trace elements like iron, copper, iodine, etc. Probably essential trace elements which we may require like nickel, vanadium, etc. 1 minute.
Yes, ma'am.
So there are certain non-essential trace elements also like aluminium, lead, mercury, and all. So among this, calcium is important essay question beta. Okay.
Yes,
So
ma'am.
calcium is most abundant among minerals in the body. Our bones are made up of calcium, teeth is made up of calcium, right?
Yes,
Skeletal
ma'am.
is made up of calcium. For muscle contraction, we require calcium. For blood clotting mechanism, factor fourth is calcium. So calcium is so important, isn't it? So it's the most abundant like mineral among the minerals in the body. So the total content calcium in adult human being is 1 to 1.5 kilograms. Okay. So because it forms skeletal tissue, muscular tissue, then functions. See, it helps in the development of bones and teeth, calcium, isn't it? So the calcium is actually like bones are made up of hydroxyapatite crystals. So those hydroxyapatite crystals are in turn made up of calcium. Okay. So we know
Yes.
osteoblasts are bone forming cells, isn't it? And osteoclasts are bone eating cells. So the osteoblastic activity is actually utilizing calcium for the purpose of synthesis of these hydroxyapatite crystals. Okay. So we know bone is, like calcium is also important for muscle contraction, which we usually study during physiology. Isn't it? Calcium ions enter inside the skeletal muscle fiber. Actin fibers will slide over myosin fibers. Isn't it?
Yes, ma'am.
Then we have blood coagulation, blood clotting factor, fourth factor. That is also very important. Okay. Then we have nerve transmission. So calcium is neuromuscular junction. If you remember in physiology, there also you see calcium is important, isn't it?
Yes,
So
ma'am.
membrane integrity and permeability also we require calcium for activation of certain enzymes like lipases, ATPases, succinate dehydrogenase. Then calmodulin mediated action of calcium. So it's a calmodulin is nothing but calcium binding regulatory protein. That means it binds with calcium. Okay. So this calmodulin also activates certain enzymes like adenylate cyclase, calcium dependent protein kinases, etc. So calcium acts as intracellular messenger. This you will
Yes,
study
ma'am.
when we
Second.
do. Can you hear me, beta?
Yes, yes, ma'am.
So it is actually as acting as intracellular messenger also. So we generally study like mechanism of the action of hormones. There is one chapter hormones. So there we will study about second messenger. So in that second messenger mechanism, you will see calcium is important. Okay. So for the release of certain hormones like insulin, parathormone, calcitonin, etc., from the respective endocrine glands, we require calcium. Okay. So there are certain mechanisms like cell drinking, endocytosis, exocytosis, release of certain enzymes by the cell, etc. Okay, cell motility. All these activities are actually regulated by the presence of calcium. Okay. Then contact inhibition. So cell to cell contact, adhesion of cells, generally the prevention of cell to cell binding and adhesion is prevented with the help of calcium. Okay. So we know like it helps in the contraction of skeletal muscle. Heart is also a muscle only, right? So it also helps in
Yes,
the
ma'am.
contraction of cardiac muscle fibers also. Okay. So how much do we require? It's given here. Like adult men and women, 800 milligrams per day. Children, zero point 0.8 to 1.2. Women during pregnancy, lactation, postmenopause, requirement is high. You see how much? 1.5 grams, not even milligrams. 1.5 grams per day. Okay. Growing children also require more only. That's why it is 0.8 to 1.2 grams per day. Infants less than 1 year, 300 to 500 milligrams. So the best sources of calcium are milk and milk products. Good sources,
Yes, ma'am.
beans, leafy vegetables, fish, cabbage, egg yolk, etc. So whatever mineral we are going to study now, remember almost all minerals are observed from small intestine, especially from duodenum. Okay. Then, so what are the factors which are required for the absorption of calcium? We know vitamin D, sunshine vitamin, isn't it? So presence of
Yes, ma'am.
sunshine is essential for the absorption of calcium. Parathormone, this is one of the hormone coming from the parathyroid gland, which are situated behind thyroid gland, isn't it? Chief cells, oxyphil cells will be there. So chief
Yes, ma'am.
in parathyroid hormone beta. Okay. So it enhances absorption of calcium through increased synthesis of calcitriol. Active form of vitamin D is actually calcitriol. Okay. Acidity is more favorable. We have acidic pH in the stomach, no? The same acidic pH will continue in the duodenum. That's the reason maximum calcium is observed in the duodenum. Then lactose, that also promotes calcium uptake. Amino acids like lysine, arginine, that also observe calcium, facilitate calcium absorption. Then what are the factors which will prevent absorption of calcium? So certain plant products like phytates, oxalates, form insoluble salts which will not allow the absorption of calcium. High dietary fiber is also actually preventing, though fiber is good in, see, high content of dietary fiber, though it is good for the lubrication of fecal matter and prevents constipation, but most of the minerals are prevented from absorption because of the presence of dietary fiber. Okay. Then high content of dietary phosphate also will prevent. Free fatty acids, they react with calcium, they form salts like soaps, that also will prevent calcium absorption. So how much should be there, how much calcium should be there in the blood? It is 9 to
9 to 11 milligrams.
very good, 9 to 11 milligrams. Okay. So suppose whenever calcium levels are falling down, that osteoclast cells will work. Okay, and they will dissolve the calcium from the bone, and they will just mobilize the calcium from the bone to the blood. Okay. So always blood calcium levels are maintained 9 to 11 milligrams. Okay. So this is a very good flowchart which helps us to understand plasma calcium is 9 to 11 milligrams. So suppose if the calcium levels are falling, then you will see bone calcium will be mobilized, so that
Hmm.
blood calcium is coming back to normal. PTH will be helping further. Parathyroid hormone. If already calcium levels are high in the blood, more than required, then that calcium will be actually deposited in the bone with the help of calcitriol, that is active form of vitamin D, D3 this is, and
Hmm.
calcitonin. Calcitonin is a hormone coming from, again, like
Parathyroid.
thyroid gland only. Thyroid gland, we have special cells in the thyroid gland. So which release calcitonin. Basically calcitonin will reduce blood calcium levels. Shubhangi, remember.
Yes, ma'am.
PTH increases blood calcium level. PTH comes from the parathyroid gland. Calcitonin comes from the thyroid gland.
Thyroid.
Okay. So thyroid gland will also release this calcitonin, which will reduce blood calcium levels. So in case if thyroid, like calcium levels are falling low in the blood, the kidney tubules, we know, isn't it nephron? PCT, DCT, proximal convoluted tubule, Henle's loop, distal convoluted tubule, that also will act actively for, and it helps in the reabsorption of calcium from the renal tubules. Okay, so PTH, plasma calcium is regained. That's how. Okay, beta. From the intestine also calcium is absorbed in the presence of vitamin D, calcitriol, PTH. They promote. That means presence of vitamin D and parathyroid hormone promotes the absorption of calcium from the intestines. Okay, beta?
Yes, ma'am.
So this, if you understand this, you can write so much. Okay. So in case actually parafollicular cells are there, beta, in the thyroid gland, which will release this calcitonin.
Calcitonin.
Okay. The same thing is elaborated. Suppose if calcium content is more than required in the blood, more than 9 to 11 milligrams, then you will see blood calcium levels is very high. You call that condition as hypercalcemia. Okay, elevation in serum calcium levels. So it happens whenever there is hyperparathyroidism. When parathyroid hormone levels are increasing in the blood, you will see bone resorption. That means bone starts dissolution. Okay, dissoluting, and you will see calcium will be mobilized from the bone and it will be transported to the blood. Okay, so that's how you will see blood calcium levels will rise. It's not good also. It may lead to the formation of like stones, kidney stones.
Kidney stones.
So other symptoms we see, if high calcium levels are there, person becomes weak, that is lethargy, muscle weakness. He doesn't feel like eating, that is loss of appetite, constipation, nausea, and increased myocardiality, myocardial contractility, and bones are being, from the bones only calcium is being mobilized, right? That's the reason bones become susceptible for fractures.
Hmm.
Then next thing, what we have quite opposite to hypercalcemia, we have hypocalcemia. Whenever blood calcium levels are falling down below 7 milligrams, then you will call it as hypocalcemia. So we know calcium is very important for the contraction of muscle. So there is a condition which is called as tetany, where you will see the like muscle will be in the form of spasm. So in
Yes.
physiology textbook, if you remember PTH hormone chapter in endocrine system, you will get a picture like this, no?
Yes.
Carpopedal
Yes, ma'am.
spasm. So there will be flexion at metacarpophalangeal joints of all the digits because of the deficiency of calcium in blood. That condition is called tetany.
Tetany.
Uh, so then rickets. Rickets usually we find in small children growing bones because of the deficiency of calcium and vitamin D. The bone shape gets deformed. Okay, bow legs, knock knees, pigeon chest, rickets, ricket rosary it is called as. Okay, beta. Renal
Yes, ma'am.
rickets in the condition, in the sense, though the baby has adequate amount of calcium and vitamin D, but thing is, kidneys like nephrons are unable to reabsorb calcium from the renal tubules. There is heavy loss of calcium in the urine. That's why the baby will suffer with bony deformities. You call that condition as renal rickets. In this case, even if you give vitamin D, even if you give calcium also, the baby will not recover because it is defect in the kidneys. Okay, beta? Then
Hmm.
osteoporosis. Porosis in the sense the bone density is reducing. The bone mineralization area has reduced. Usually we see osteoporosis as the age advances. Okay. Old age, after menopause, especially in case of females only, we see unfortunately the bones become very weak and they are prone for fractures. Okay, so that's the reason after menopause we should recommend increased amount of calcium intake. Okay, beta. So treatment, because hormonal deficiencies are there, we have to give estrogen also, calcium supplements, so as to overcome this condition of osteoporosis. We can prevent these fractures. Osteopetrosis is like increased bone density. Okay, bone resorption is not occurring. This is quite opposite to osteoporosis. Okay, so this is all about calcium. Once we are done with calcium, phosphorus also will be almost similar to calcium. Phosphorus also may come, basically it may come as 5 marks but not 15 marks question. Okay, for any
Yes, ma'am.
mineral, you have to remember the like serum levels. You have to remember how much is required in the diet, what are the functions, and what are the deficiency disorders. Under these headings, you should remember better.
Yes, ma'am.
So that is excretion disease. Serum phosphate level is increased in hypoparathyroidism and decreased in hyperparathyroidism. Not much is given because it is almost same like calcium only better. Both work together. Okay. Calcium phosphate we say. See, phosphate is essential for the formation of bones, teeth. Almost same functions only we will find. Dietary requirement. See again, it is found in human milk. Milk is again good source of phosphorus also. Cereals,
Phosphorus.
same sources we get. Almost functions, deficiency disorders are also almost same. Next, magnesium also may come as 5 marks or 3 marks question better. Okay. Here also you check just only 3 functions are given. Formation of bones, teeth. It's a coenzyme. For many enzymes like hexokinase, glucokinase. It's also
Finance.
necessary for neuromuscular function. Dietary requirement, adult male, female is given. Sources you try to remember. I told you almost all minerals absorption is small intestine. Okay, serum levels you try to remember, and deficiency disorders. So suppose magnesium is not there, there is neuromuscular irritation, weakness, fits. Okay, generally we see this condition in uremia, that is urea levels are increased in blood, that is uremia. Then rickets and abnormal pregnancy. Sodium, even sodium is 5 marks or 3 marks question only. It never came as an essay. Again, just see the functions better. It helps in the maintenance of acid-base balance, helps in maintenance of osmotic pressure for normal muscle contraction. It helps in the absorption of glucose, galactose, and amino acids. Okay. So dietary requirement 5 to 10 milligrams, grams per day. We usually take in the form of salt, no? Nothing.
Yes, ma'am.
Huh? So sources, common salt is the most common source. Apart from that, we also get from bread, like whole grains, leafy vegetables, nuts, eggs, and milk. Okay, absorption, GIT, plasma sodium levels is important. It can be asked in 3 marks also. Better. Okay, 135 to 145 milli equivalents per liter. It's excreted in the urine. Okay, and it is controlled by the hormone aldosterone. From where it comes? Adrenal gland, adrenal cortex, isn't it? Zona glomerulosa. We see this hormone coming. So disease state. Suppose if sodium levels are low in the blood, you call that condition as hyponatremia. Hypo is less. If sodium levels are high in the blood, you call it as hypernatremia. Okay. So hyponatremia generally we see in dehydration, like we have studied in acid-base balance, right? Diarrhea, vomiting, renal diseases. Okay. Hypernatremia, elevation of serum sodium levels. So generally we
Yes,
see
ma'am.
Cushing syndrome.
Consider.
So in case of hypernatremia, whenever sodium retention is there, the person will suffer with edema. Okay, water and sodium concentration in the body is elevated, and there may be high blood pressure also, hypertension. Okay, next mineral comes potassium. So it is intracellular cation. That means it is found inside the cells. Function again same like sodium almost. Maintains intracellular osmotic pressure, acid-base balance. Pyruvate kinase is dependent on potassium for its activity, for transmission of nerve impulse, okay, for biosynthesis of proteins by the ribosomes, for normal cardiac activity also. The normal dietary requirement is 3 to 4 grams per day. Sources of potassium, we have banana, orange, pineapple, etc. Absorption GIT, normal potassium levels 3.4 to 5 milli equivalents. Excretion is through urine. Diseases. If potassium levels are low in the blood, you call it as hypokalemia. Okay, kalemia is
Yes,
not
ma'am.
calcium. Remember that. Hypocalcemia is calcium.
Calcium.
Calcemia is calcium. Kalemia
Yes, ma'am.
is calcium. Calcium
Potassium.
is the Greek word we usually study in intermediate, no, for potassium. Formula is also K, potassium K, kalium.
Yeah.
And hypokalemia, hyperkalemia. Okay. Chlorine also can come for 3 marks or 5 marks better. Almost same. Few things we have to just compare, like what is the few functions you have to remember. See, acid-base balance, it helps in the formation of HCl in the stomach. Okay,
Chlorine. Yes.
helps in chloride shift mechanism also. What we have studied in like renal regulation of blood pH. Do you remember, beta? Chloride shift has come there.
Yes, ma'am.
Enzyme salivary amylase. So dietary requirement 5 to 10 grams. So sources of chloride, like same sodium chloride we say, salt.
Salt. Okay.
Sources apart from salt, whole grains, leafy vegetables, etc. Absorption GIT, plasma chloride 95 to 105 milli equivalents. Excretion will be again in the urine only, but sweat and all. Loose motions, vomitings also we may lose this chloride. Hypochloremia is low potassium levels, low chlorine levels in the blood. Hyperchloremia, excessive chlorine levels in the blood. Next comes sulfur. Sulfur is not that important. We have few sulfur containing amino acids, no? Methionine, cysteine.
Methionine and cysteine.
So sulfur is important for the formation of sulfur containing amino acids. So certain vitamins are there which are containing sulfur in their structure, like thymine, biotin, lipoic acid. It may be asked as 3 marks question also better. Sulfur containing vitamins. You have to give this second point. Okay.
Yes, ma'am.
Heparin. It is an anticoagulant, right?
Anticoagulant.
Uh,
Yes, ma'am.
Chondroitin sulfate. We generally study it under glycosaminoglycans in first chapter, carbohydrates, chemistry.
Yes, ma'am.
Isn't it? Huh? So that is chondroitin,
Heteropolysaccharides.
tarocolic acid. They are all made up of sulfur beta. PAPS. So phosphoadenosine phosphosulfate. Active sulfate utilized for several reactions. So wherever sulfur is involved, generally PAPS will be donating this sulfur atom. Like we need 1 carbon compounds. What do we have? SAM, no?
Hmm.
Acetylcysteine. Similarly, for the donation of sulfur, we need PAPS. Okay. Then dietary requirements. This you can easily study, right, beta? Iron is an essay
Yes.
question.
Yes, ma'am.
Very important. What are the functions? See, we know it is present inside the hemoglobin. Hence, it helps in the transport of oxygen and carbon dioxide. In the muscle, we call it as hemoglobin. In this blood, inside the RBC, we call it as hemoglobin. No? So there are certain coenzymes like cytochromes, which are also very important for electron transport chain, oxidative phosphorylation. Certain
Hmm.
peroxidases, they also require like iron beta. It is helping in immunocompetency of the body. Okay, that means helping in the maintenance of our immune system. So dietary requirements, adult man, how much do we all dietary requirements, sources you can easily study better. Absorption, we know it is from the GIT, duodenum, small intestine. Again, acidic pH is required. Okay, then see, acidity is required for the iron absorption, right? Suppose if the person has deficiency of iron, the absorption of iron will be increased 2 to 10 times. Small peptides, amino acids also favor iron absorption. Okay. Then phytates and oxalates, they prevent the iron absorption better. And
Yes,
you
ma'am.
have to study this very, very important flowchart better. So suppose we are taking iron in the diet. That iron is entering into the lumen of our GIT, food iron. It will be converted into Fe3, ferric form. So in ferric form, remember it is not reabsorbed from the GIT. It has to be converted into ferrous form, Fe plus 2. So ferric form can be converted to ferrous form in the presence of vitamin C,
See.
ascorbic acid and cysteine. Okay. So ferrous is transported from the lumen of GIT into the mucosal cells of the GIT. Okay. So
Yes, ma'am.
apoferritin plus ferrous, all these series of steps you try to just memorize this, but finally you will see excess iron will be stored in the liver in the form of ferritin, hemosiderin. It can be also stored in the bone marrow in the form of hemoglobin, muscle, myoglobin, other tissues like cytochromes and this non-heme iron. Okay, so that is absorption of transport and transport of iron. It is a part of essay question. Okay,
Yes, ma'am.
this is not so much important, but that flowchart is important. And of course, we know deficiency of iron will cause iron deficiency anemia. If iron is deficient, you will see the RBC process formation doesn't take place normally. The size of RBC will reduce. You call that condition microcytic. The RBC also become pale. You call it as hypochromic. Okay. So
Hmm.
microcytic hypochromic anemia. Suppose if iron levels are excess, then you call that condition as hemosiderosis. Okay, that is also not good. Okay,
Yes, ma'am.
people who cook their food in iron utensils, what happens
Hmm.
as it's more deposited in the body. Okay, so that is usually not so good. Hemochromatosis. Iron is directly deposited in tissues like liver, spleen, pancreas, and skin. The skin also becomes black in color, pigmentation. You call it as bronze pigmentation. Okay,
Hmm.
internal organs also and outside skin also you will see full iron pigmentation. We call bronze diabetes. Okay, next mineral is copper. So body contains about 100 milligrams copper. Copper is important but 5 marks, not essay. Okay, so again you just see like what are the enzymes which are made up of copper, like oxidases, catalases, and so on. Helps in the synthesis of hemoglobin. And we have certain copper containing enzymes for the which are required for the conversion of lysine residues of collagen. That means it helps in the formation of collagen fibers, protein formation, nothing but.
Hmm.
And ceruloplasmin is ferrooxidase. That means iron and copper together we have here. You call it as ceruloplasmin, ferrooxidase. It helps in the conversion of iron to ferrous to ferric form better.
Hmm. Yes, ma'am.
Just now we saw no in the previous flowchart of iron. Okay, then it helps in the synthesis of melanin, phospholipids. It helps in the development of bone, nervous system, and all. Okay, all this is copper is important, but I'll read carefully. So see the dietary requirements, sources, absorption, mainly duodenum, plasma, normal range. You should remember. Disease states can come as 3 marks questions also. Copper
Yes, ma'am.
deficiency, it causes demineralization of bone, demyelination of neural tissue, anemia, blood vessels may become weak, myocardial fibrosis and all. Menkes disease, defect in the intestinal absorption of copper. Deficiency is Menkes, excess is Wilson's. Like we had hyperchromatosis for iron, no? If they use iron utensils, similarly, Wilson's is excessive copper deposition.
Yes,
Okay,
ma'am.
you will see it is deposited in the liver, damaging the lenticular nucleus of brain. Okay, it may damage liver, causing hepatic cirrhosis, brain causing brain necrosis. Okay, so copper will be excreted in urine also. Kidneys are damaged. Intestinal absorption is very high in this condition, Wilson's disease. Generally, we don't know what is the cause, but failure to synthesize that ceruloplasmin, converting that ferrous to ferric to ferrous form, we require the ceruloplasmin, no? It's a coenzyme.
Yes, ma'am.
Reduced intestinal excretion also may be one of the reasons for Wilson's disease. So in case of Wilson's disease, we need to give certain drugs like penicillamine, which will be chelating agent in the sense it will form insoluble salt with copper and it will excrete copper. That is the meaning, chelating agent. Okay, we usually use penicillamine. So next we have iodine better. So iodine, we know like thyroid gland is synthesizing thyroid hormones by utilizing this iodine, isn't it?
Yes, ma'am.
Four hormones are basically made up of iodine. We have studied this when we were doing first chapter, protein metabolism, right?
Yes, ma'am.
Sin it combines with two iodines plus two iodines,
Two iodine.
monoiodotyrosine, then
Diiodo.
iodotyrosine, triiodo is T3, tetraiodo is T4, right?
Yes, ma'am.
So dietary requirements, you try to remember sources, seafoods, drinking water, vegetables and all. Absorption is small intestine. Functions, no. Generally, whatever functions we usually study for thyroid hormone, it helps in the maintenance of basal metabolic rate beta functions. Okay. So mainly, so whatever functions we usually study for T3, T4 hormones, they are the functions of iodine. So normal iodine content in the blood is 4 to 10 milligrams. Okay. So in case if iodine is deficient, it leads to a condition called as goiter.
Goiter.
Manganese can be a 3 marks question better. So you can generally study whatever, anything you can write for any mineral, broad way of thinking. Anyhow, it will click somewhere. Okay. Like many minerals you should have seen, they are all coenzymes, cofactors, no? They help in formation of bone. So don't leave the question, write something. Okay. Hemoglobin synthesis, lipid peroxidation, cholesterol synthesis, like that. This is manganese. So dietary requirements, sources, absorption, and all you see that. So similarly for zinc also, try to read under these headings only. What are the functions? Zinc can come for 3 marks. Okay.
Yes, ma'am.
Prostate gland is rich in zinc. So it helps in the, like several enzymes are containing zinc, like carbonic anhydrase, alcohol dehydrogenase. It also acts as an antioxidant. Gust, a zinc containing protein of saliva, is important for taste sensation. Okay. So dietary requirements, you can check sources, absorption. Molybdenum, fluorine, cobalt are, fluorosis is important, but fluorine is important. Okay.
Yes, ma'am.
So excessive fluorine, Nalgonda population, we generally see mottling of teeth, yellowish discoloration of teeth. So that condition is fluorosis. Okay. Deficiency of fluorine is caries, dental caries, tooth decay. Whereas excess fluorine is fluorosis beta. Okay.
Yes, ma'am.
These are small things. So don't leave anything. At least some points you should be able to write. Just refer the question bank, what questions have been asked. and then study better. Okay.
Yes, ma'am.
So